Fatty liver is one of the most common health findings today. And yet, it is also one of the most misunderstood. Many people hear the words fatty liver for the first time after a routine blood test or an ultrasound. They are often told not to worry too much. Or they are told to lose some weight and come back later. But very few people are actually told what fatty liver really is. So let us start from the beginning, slowly and clearly. Fatty liver does not mean your liver is failing. It does not mean your liver is damaged beyond repair. And it does not automatically mean something dangerous is happening right now. Fatty liver means that fat has accumulated inside liver cells beyond what is considered normal. The liver normally contains a small amount of fat. That is not a problem. The problem begins when fat makes up too much of the liver's structure. When this happens, the liver becomes heavier, less flexible, and less efficient at doing its daily work. To understand why this matters, you first need to understand what the liver actually does. The liver is not just an organ that filters toxins. That is an oversimplification. The liver is a metabolic control center. It processes nutrients after every meal. It manages blood sugar levels. It stores energy. It regulates cholesterol and fats. It produces bile to help digest food. It helps control inflammation. It plays a role in hormone balance. All of this happens quietly in the background every single day. When fat builds up inside liver cells, these processes do not stop, but they do become less efficient. This is why fatty liver often has no obvious symptoms at first. The liver is very resilient. It keeps working even when conditions are not ideal. That resilience is both a strength and a weakness. Because symptoms are often absent, fatty liver can develop slowly over years without drawing attention. Many people are surprised when they are told they have it. They feel fine. They have no pain. They are still functioning. And that leads to confusion. So what causes fat to build up in the liver in the first place? The most common cause today is metabolic overload. This does not mean eating fat directly turns into liver fat. That is a common misunderstanding. Liver fat is more closely related to how the body handles energy overall. When you eat carbohydrates, sugars, and excess calories, the body has to decide what to do with that energy. Some of it is used immediately, some of it is stored in muscles, some of it is stored as fat under the skin. But when these storage systems are overwhelmed, the liver becomes a backup storage site. Over time, the liver starts converting excess energy into fat and storing it inside its own cells. Insulin resistance plays a key role in this process. When the body becomes less responsive to insulin, blood sugar control becomes less efficient. The liver responds by increasing fat production and storage. This is why fatty liver is so closely linked to conditions like prediabetes type 2, diabetes, and metabolic syndrome. It is not a separate problem. It is part of a larger metabolic picture. This is also why fatty liver can occur even in people who do not drink alcohol. For many years, liver fat was mainly associated with heavy drinking. That is no longer the case. Today, non-alcoholic fatty liver disease is far more common. Alcoholic and non-alcoholic fatty liver may look similar on imaging, but the underlying drivers are different. One is driven primarily by alcohol toxicity. The other is driven primarily by metabolic stress. Understanding this difference matters because it changes how the condition is approached. Another important point is that fatty liver is not a single stage. It exists on a spectrum. At the earliest stage, fat is present, but there is little or no inflammation. This stage is often called simple fatty liver. At this point, liver cells are enlarged by fat, but they are not severely injured. As metabolic stress continues, inflammation can develop. When fat and inflammation exist together, the liver becomes more vulnerable. This is when the risk of progression increases. Over time, chronic inflammation can lead to scarring, also known as fibrosis. In advanced cases, extensive scarring can interfere with blood flow through the liver. This is how fatty liver can eventually progress to cirrhosis in some individuals. But it is very important to say this clearly. Not everyone with fatty liver will progress. In fact, many people never do. Progression depends on multiple factors: metabolic health, blood sugar control, inflammation levels, genetics, lifestyle patterns over time. This is why understanding fatty liver early matters. Not to create fear, but to create awareness. Another common misconception is that fatty liver always causes pain. In most cases, it does not. The liver itself does not have many pain receptors. This is why fatty liver is usually discovered through imaging or blood tests, not symptoms. Sometimes, people report vague discomfort on the right side of the abdomen, fatigue, or low energy. But these symptoms are nonspecific and can have many causes. This again contributes to confusion. Blood tests can offer clues, but they do not tell the whole story. Some people with fatty liver have elevated liver enzymes. Others do not. Normal blood tests do not rule out fatty liver, and abnormal tests do not always indicate severe disease. This is why fatty liver often creates uncertainty for patients. They are told something is there, but they do not know how serious it is or what it means for their future. This channel exists to address that gap. Fatty liver is not a moral failure. It is not simply about willpower, and it is not always visible on the outside. It reflects how modern lifestyles, food environments, and metabolic stress interact with the body over time. Understanding fatty liver means understanding how the body adapts when it is under constant energy pressure. It also means recognizing that the liver responds slowly. Changes do not happen overnight, and improvements also do not happen overnight. This is why extreme solutions and quick promises are rarely helpful. Real change happens gradually as metabolic balance improves. In future videos, we will explore how fatty liver is diagnosed, how lab tests and imaging are interpreted, and how lifestyle factors influence liver fat over time. But the foundation is this: fatty liver is a metabolic condition. It develops quietly. It often has no symptoms, and it exists on a spectrum. Understanding it clearly is the first step toward managing it wisely. If this topic is relevant to you, take the time to learn how your liver works. Not out of fear, but out of understanding.